Hello, this is James St. James, and in this episode we're going to be talking about the 6 types of pain. Let's learn about the functional anatomy of the human body from a healer perspective so that we can reverse engineer intuitive healing so that we can re-engineer our body and mind to think and perform how we want. The body is a genetic marvel resulting from eons of natural engineering that has suited itself from countless survival challenges and environmental circumstances. After so many millions of years of repeated improvement and adaptation, we now have bodies that have what we can think of as having certain innate tools, which care for damage and isolate invasive immune threats automatically. We even have a few other tools that we can tap into voluntarily and use purposefully to facilitate what I refer to as the healing process. In this series, we're covering all the fundamental concepts that we need in order to start the healing process. The nervous system, which we can think of as the computer system of our body that includes the brain, spinal cord, and all the connected nerves, is one such tool that we want to leverage if we want our body to heal more quickly and completely than it otherwise would. To do this, it's critical that we understand how pain relates to our nervous system so that we can see the role that pain plays in the process of healing. In our nervous system, there are multiple types of nerves, and the ones responsible for communicating signals of pain to our brains are called nociceptive nerves. We'll come back to that in a moment, but first let's talk about pain, because it's commonly believed that pain is just bad, and understandably so, because it hurts. However, the truth of the matter is that pain is so essential to life that no species would have ever survived long at all without it. This is because of what pain does. It alerts the organism to the damage and initiates the body's natural healing mechanisms. Furthermore, it creates emotional association that we can learn from to help us avoid future damage completely. For these reasons, we can really think of our feelings of pain as the harsh yet honest words of our closest, most caring friend who truly wants what's best for us, even in our most hurt moments. In many ways, it wouldn't even be too far of a stretch to extend our appreciation for pain to the level of spirituality. One of Buddha's most famous quotes is, "Don't throw away your suffering. Touch your suffering, face it directly, and your joy will become deeper," meaning that through pain is the path to joy. So we can use pain as a tool to get to where we want to go. So while it's easy to think that pain is just bad, what if we were to think of it more as a tool that our body can use to heal and regenerate ourselves when we're hurt? With this kind of perspective, we put ourselves in control of the pain and not the other way around, and we can learn to leverage the heck out of it in a way that moves us toward our goal of perfect health. Would you be willing to learn more about pain if it could lead you to the life that you love? So let's dive in by going over the various types of pain and why we should not confuse them. Yes, there are actually different types of pain or signals that our nociceptive nerves send to our brain. Each signal has its own characteristic feeling and purpose. To confuse or generalize them could be a very grave mistake that leads to more damage and pain rather than more healing. See, a lot of people move through life desperately trying to avoid pain, disregarding what kinds of pain they're actually avoiding. What kind of pain is it? In what circumstances are they feeling it? And what are the internal and environmental factors that are contributing to that pain? I believe that by adding more clarity, definition, and refinement to our concept of pain, it will offer us more effective ways to heal the body and respond to the inevitable pain in life in a way that reduces the likelihood of illness. So first, let's talk about the 6 types of pain, or nociception. 1. Pinching or sharp pain. 2. Soreness or dull pain. 3. The hurts so good feeling. 4. Itching or tickling pain. 5. The intermediary nociceptive response, or inner. And then 6. Numbness or no feeling. If there was a 7th type of pain, it would be the sudden feeling of coolness, although this has more to do with the lack of signals being transmitted to the brain, kind of like a phantom limb effect. This is when the nerve signals go between numb and signaling. So if you cut a nerve completely, you might get this feeling, but for the sake of the healing process, we can completely skip this, as this type is usually temporary and unlikely under normal circumstances. So let's start with the first type of pain, called sharp pain. Sharp pain, such as when you get a scrape or poked by a thorn or even a burn, is due to tissue damage. When cells are ruptured, they leak chemicals into the surrounding tissue, which are detected by nearby nerve cells that refer a signal up to the brain that we experience as sharp pain. This type of pain is something that we should try to avoid. Second, sore or dull pain is probably the most common and is also the most confusing of all the types of pain. This pain might come from the form of headaches, swelling from an injury, or irritation such as a stomach ache. Because this is the most prevalent type of pain, there are many different circumstances in which we will experience it. Some are bad, but most are good. Why do I say most are good? Because sore pain indicates that your brain is aware of this damage, but without sharp pain, there is no new tissue damage happening. So awareness without damage is probably the ideal state for an organism. It means that the mind is aware of the irritation and can actively send the necessary information and resources to heal the tissue. So here I'm assuming that the irritation has already happened and that the tissue is not currently being damaged further, as might be the case when it comes to something like a bacterial infection. In most cases, such as a headache, the dull pain is a good thing. A lot of people don't like headaches because they're quite bothersome, but have you ever asked yourself why your head is aching? Previously, doctors and scientists have postulated that it could be due to dehydration or improper blood flow to the brain. However, the brain is a very tightly controlled system, and even a couple % change in the blood delivery could easily lead to a loss of consciousness and may even cause some level of permanent brain damage. So simply chalking it up to dehydration or poor blood flow would be highly unlikely. It is possible that you could get a headache from something traumatic happening internally, but at that point you would only have minutes to get into surgery to prevent severe consequences. This really only happens in extreme circumstances such as automotive or sports accidents. However, that's not really the case for most headaches or migraines that people experience. Most of the time, headaches are caused by changes in tension of the fascial matrix over the head. Now, change isn't necessarily a bad thing. However, most of the time, if the fascia changes around the head, it's due to increased stress. The most fascinating part to me is that when stress adds up and compounds on the head, we actually don't feel it, as it's very slow and usually progresses over months or even years. We only really notice sudden changes, and there is no way that much stress could be added to the fascial matrix on the head in that short a period of time, maybe with the exception of drug overdoses. So it's many times more likely that compounded stress on the fascial bands wrapping the head have started to shift and release due to the body trying to heal and relax. So what you experience as a headache is actually the sudden and incremental release of the numerous layers of tensed fascia bands wrapping the head. A migraine is similar, except with the added component of the fascial bands also affecting the top of the cervical spine, typically from the base of the skull to the C3 vertebra. The reason is that the nerves coming out of the spine in this region are linked to things like our sight, hearing, balance, and smell, thus giving us the feeling of dysphoria along with the dull pain of the changing tension of the fascial headbands. But again, if you're noticing change, unless you're in the middle of a traumatic accident, that just means that your body's trying to remove stress. Headaches are just one example of why I say that this type of pain can be the most confusing. Overall, if you feel dull pain without sharp pain, it means that your mind is aware of the damage that exists, but is not acquiring any further damage, which is a good thing, as it leaves room for your body to heal what is damaged. Next is what is described as the hurts so good feeling. A simple example of hurts so good might be the feeling of a deep tissue massage or even rough sex. It may hurt, but at the same time your subconscious wants more. So how can this be so? Your subconscious feels change happening, which is like a dull pain, but it also recognizes what is good for the body in the long run. So this is what we experience as hurts so good. This is actually one of the most ideal types of pain to find and focus on when it comes to navigating where to place your efforts during the healing process. The next type of pain feels like an itchy or tickly feeling. When the ends of our nerves and the tissues become hyperstimulated, sometimes because of some external irritant and sometimes because of the disconnecting and reconnecting of the nerves in damaged tissue areas, tickling or itching will happen. This type of pain has quite a potent effect on the mind because when something tickles or itches, we lose all control until we can stop it, which we usually do by scratching, right? This likely works because in order for the nerve to work right, the tissue around it needs to be structured properly. With itchy pain, the current state of the tissue is causing the nerve to misfire, leading to that itchy feeling being sent to our brain. And in terms of the healing process, this is really cool because wherever we feel tickling and itching, it indicates that our nerves are reconnecting with the tissue in the final stages of the tissue repair process. So scratch away and enjoy the satisfaction of a nice payload of endorphins to the brain to reward you for a job well done. One thing to note is that toxins such as poisons from insects can lead to a histamine release, which will also cause itching. So not all itching is good. You might want to check for your skin for blemishes, but first before getting too carried away. Next is my personal favorite type of pain. This has not yet been added to the medical literature, but I think it should be. I refer to this as an intermediary nociceptive response, or INNER for short. It's a type of signal that gets sent along the nociceptive nerves when they are unable to signal normal pain from the damaged tissue area. Instead, they send a very powerful signal seemingly due to a malfunction in their connectivity. The feeling is something like when you hit your funny bone, a direct nerve signal straight to the brain that is extremely agonizing and, in my opinion, many times worse than the sharp pain. This type of pain can be felt when you press hard on what are referred to as trigger points. Trigger points are a series of points in the body that are used in trigger point therapy, where patterns in the fascia cross along with intersections in the electrical channels. There's an increased likelihood of electrical and stress-related damage in these areas, so when you press on these points hard and hold the pressure, it stretches those fascial fibers, which often radiates nerve signals to remote places in the body. As agonizing as the intermediary nociceptive response is, it is also the most important when it comes to the healing process. I often refer to the trigger points as the gateways to good health because they're almost always a good place to start in a healing strategy. However, they are not for the lighthearted, since therapies such as trigger point therapy that create the intermediary nociceptive response are barely tolerable even for the toughest people. However, after you spend some time with it, I'm sure that you'll eventually adapt to it and maybe even learn to love it, because through the healing process, you'll begin to see the benefits of what is possible from tracing this type of pain. The sixth and last type of pain is actually more of a lack of pain, which is numbness. This is simply when there is damaged tissue in the body, but the mind has no ability to sense that damage. This is due to the tissue being so damaged that nerves cannot operate at all. This is the worst and by far the most scary type of pain because it indicates severe amounts of damage and there is no awareness of it. So it's very unlikely that the mind could do anything to heal it. Only through vigorous therapies and tissue manipulation can one hope to regain the feeling in such tissues. From my experience, it's a very long road to recovery, and very rarely will tissues like this ever be able to recover from this level of damage without an effective healing strategy. It's very important to differentiate between these types of pain because different types of pain require different responses for best results in our healing. And we must not be ignorant when it comes to something so vital for our experience in life and possibly our only hope in regenerating our body. So I hope that by better understanding the 6 types of pain that you can better formulate healing strategies and focus on the techniques that are going to create the most positive benefits in your body. Generally, one should always avoid sharp pains when it comes to the healing process. But when it comes to a healing strategy, there are some instances where sharp pain is unavoidable or even necessary. So let's recall the levels of damage from episode 5 in the series. And by the way, check that out via the link below in the description if you have not seen that yet. In the later stages of resolving level 3 or 4 damage, the center of the damaged areas will sometimes have level 5 damaged tissue that is unmovable and has no hope whatsoever for regenerating. So in that case, it is better to not worry about breaking a little bit of tissue that's not usable anyway, as it will have to break in order to regain the overall functionality. This will likely cause a sharp pinch, but done in the right way will be inconsequential to your overall health. In contrast to these healing strategies, many times in the field of physical therapy, practitioners will instruct their patient to just push through the sharp pain of a therapy in order to regain critical functionality. But keep in mind that this is quite opposed to what I'm talking about here. The goal of physical therapy is strictly mechanical rehabilitation and mobility and does not consider the rehabilitation of the electrical components of the body. so oftentimes tissue and body health are sacrificed for overall mobility. In severe circumstances, this can be very useful, but this is quite detrimental for stress-related issues, as delicate electrical components that cannot be seen can become easily damaged. So for the purpose of the healing process, do your best to avoid sharp pain unless it is truly unavoidable. At the same time, be like a heat-sinking missile when it comes to the other 5 types of pain. If you feel them, use your mind to amplify that signal and increase the intensity of the pain. Make it vivid. Allow yourself to be consumed by it. Maybe even fall in love with it. Okay, maybe that's too much, but the more awareness that you have, the better your chances for repairing your body. Hopefully now you understand a little bit more about how to discern between the various types of pain. In the future, we'll cover ways to create healing strategies depending on which types of pain and which levels of pain that you have. Follow me to the next episode where we are going to talk about the 10 techniques by which we can heal. If you want to learn more about the body and mind, then feel free to check out the other videos in this channel or subscribe. And if you have a question about anything, then drop it in the comments and I'll do my best to answer it. I'll see you in the next video.